Hey there, my lovely people. It's Kim, your nurse coach, as well as hospice nurse. So, I just wanted to spend just a few minutes talking about really what to expect in those end of life days. I had a patient today that is on what we call GIP, which is a general inpatient. It's someone that has we have symptom management that we can't manage at home, or it's someone that really wants to be on hospice but is too unstable to transport home, which this patient was. So we placed him on GIP yesterday, and I go and I talk with the family today about his condition, what to look for, what to expect. And I always tell everyone that I am very blunt, I'm very honest, and I'm gonna tell you like it is, because most people really want to know what it is that they're getting into, what to look for when their loved one is dying. So, what I, as a nurse, look for is, and I tell this to the families, is we're looking for those one thing, we're looking for those vital signs. We're looking for those vital sign changes, whether it's that blood pressure is decreasing, excuse me, their heart rate, their respiratory rate is decreasing. A lot of times I'll say, and you'll see me a lot of times talk, I like to talk with my hands. So I tell families, I say a lot of times that heart rate and that um, respiratory rate may be high. So it may be, we look at a normal heart rate is less than 100, a normal respiratory rate's less than 20. So when those patients' heart rate and respiratory rates over those numbers, then I begin to get concerned that the time is beginning to draw nearer. Then, as they begin to have the dying process, those numbers will decrease. Sometimes you'll see the heart rate decrease before the respiratory rate, vice versa. Sometimes both of them decrease. We're also looking for that oxygen saturation to decrease. If it's getting low, like this gentleman's was like in the mid 80s, and he was still on oxygen. And at that time, that oxygen really was not doing him any good. So I said, let's go ahead and discontinue that oxygen because that oxygen's really not doing your loved one any good at this time. It's really more as a comfort for the family. And they're like, so when you explain it that way, they're like, okay, well, let's just discontinue that. And I've not ever had a patient's family say, nope, I want to keep them on oxygen. They're usually like, okay, well, let's just discontinue that. So we did that. And I talked to them about that. Those other, sorry, y'all, those other signs and symptoms that I look for that you, as the family member, can help me even look for, especially if they're at home or if they're in a facility and you're there every day in that facility seeing that patient, is you may have some modeling of the skin. And that's where it, really kind of what it says. It's like the skin is not all nice and pink. It might be um, modeled, best way, honestly, that I can say. It might look like that it's got um, kind of like maybe if it's sunburnt and it's sunburnt in a particular area and it's not sunburnt, or if it's suntan in a particular area. And that's kind of what modeling is. You don't always see that in hospice patients. I honestly, in the number of years that I've done it, I've seen it in very few patients. It's normally those vital signs that I begin to look for. Also, the patient becomes unresponsive or unconscious. They can still hear. We always say that families can, or not families, excuse me, that patients can hear. So we're looking at, are they unresponsive? And most of the times they are going to be unresponsive when it's those last few days, even those couple of hours. They're going to be unresponsive. They're going to have stopped that eating, stop that drinking, and those are what we begin to look at. Okay, this person's getting closer and closer to getting ready to expire. So those are just some different areas that you can look for as you are dealing with a loved one that is on hospice care, or if they're not on hospice care, maybe they need to be on hospice care, because hospice, we're able to manage the symptoms. Like this gentleman today was having that really labored breathing, so we give him medicine, which is normally morphine. Morphine is not going to hasten that person's death, everyone. I tell family members we give it's like a 30 ml bottle of morphine. I can give that patient that entire 30 mLs, and that's not what's going to, and I'm using air quotes, kill that patient. What's going to take that patient's life is whatever that disease process is, whether it's a dementia such as Alzheimer's or Lewy body's dementia, or whether it's congestive heart failure, or whether it's cancer. That's what's going to end. What the morphine is doing, and I want everyone to plainly understand this, is the morphine is helping them to be comfortable. It's helping them to breathe easier, to not be in pain. We also give lorazepam, which is another medicine that we give to help with that end of life, because families want their loved ones to be comfortable, and that's what we want. We want them to pass peacefully and not have a hard time. So that's it, folks. If you have any questions, drop me a line. I'm only doing this like most people do, down below. Comment. You can find me. You can look at my website. It's kimholdencoaching.com. If you want to know more, if you want some coaching through the death or the end of life of your loved one, or if you want some coaching as far as stress management and what to do holistically with stress management, shoot me a message and we'll get on a chat and chat. But I hope y'all have enjoyed this, and I'm going to try and begin to do this more regularly. Thanks, guys. Have a great night. Bye.